Hey guys, it's Dr. Kelsey, and this is October, so we're looking at and focusing on boxers. This is Dempsey, and that's Aria, which may be out of the camera shot, I'm not sure. And they are two boxers, and I'm going to talk to you a little bit about a couple of the medical conditions. These are brachiocephalic breeds, right? So, they have the smush nose face. And so if you have a boxer, one, they require a lot of energy, or require a lot of exercise because they have a bunch of energy, right? And you want to be careful though with them in the summertime because sometimes they can easily overheat if you exercise them too much. And of course right now we're in the winter months, we're getting in the fall, so it's cooler and all, but if you exercise them a lot in the summertime, you just got to be really careful with them not to overdo it. Again, they would go and go and go if they could, but they can get overheated. So that's one thing. Another issue that boxers can get is, and luckily it's later in life, there's an actual condition called boxer cardiomyopathy. And that's a fancy term for basically boxers do get a heart condition that's kind of common in, well obviously common in boxers, but they get dilated cardiomyopathy. So it's a muscle disease of the heart. I know, you're so cute. It's a muscle disease of the heart. And they basically can get heart disease. They're a little bit more prone to it as a breed. You might see a dog that might be getting a little more lethargic or not as much energy, eventually start coughing. And we would check them out and we would listen and hear their heart, and they might have a heart murmur going on. And then a lot of times we'll have an echo done. This is one that you released. Yeah, an echo done, a heart ultrasound, and get it officially diagnosed. There's medicine for it, but again, it is something in the breed. Probably the second one I would tell you about, or the third one I guess, is what are called mast cell tumors. We've done another video, I think, a little bit more detailed, but on mast cell tumors, M-A-S-T, and they are skin tumors of dogs. Unfortunately, boxers are a breed that do have cancer or do get cancer a little more prevalently than other breeds. And mast cells are skin tumors, so especially if you've got a boxer that you see a lump or bump, and luckily on a boxer, again, you can see it pretty easily because their hair is really short. It's definitely worth getting checked out. So if you've got a boxer with a lump or bump, have that evaluated, make sure it's not a mast cell. If it is, there's surgery. That's what we do, is remove them. Again, we've got more info in another video about some mast cells, but that's kind of the things. I'd say overheated, the heart condition, and also skin tumors and such. So if you're looking at boxers as a breed, they're great, they're a lot of fun, but they do have those issues that you might want to be aware of before you purchase one.